Moving to a new country is exciting, but at the same time can be daunting and also scary. And moving as a doctor to work in Australia can be one of the defining moments of your career. There are challenges, of course, that come with moving. First, because you're an immigrant, and as an immigrant, you'll experience the various challenges that are faced by immigrants, mainly, adjusting in. But on the other side, as a doctor working in the healthcare system in Australia, there are challenges that will be peculiar to you as a doctor, and that can be extremely daunting, especially if you are unaware of these challenges. And so in this video, I will just be explaining some of these challenges that have been experienced by other IMGs, and also try and offer some tips on how you can maneuver these challenges and allow you to settle in a bit quicker and allow you to just quickly adjust to working in Australia. One of the biggest challenges faced by IMGs, and this has been documented across various platforms, and I was looking at the AMC survey. There was a survey that was done by Australian Medical Council across about 4,000 IMGs. And one particular challenge that was clearly came out at the forefront was communication challenges. First, because communication can be a bit difficult, especially for IMGs coming from non-native English-speaking countries. But at the same time, communication that is geared towards specifically the Australian system. Australia is interesting because it is highly, it is quite cosmo. In that, I mean, a lot of people living in Australia by themselves are probably immigrants of some sort. But additionally, we have the Indigenous Australians. So it is quite important to acknowledge that fact that communication can be a bit difficult, not because of just not mastering the English language, but also because of the language that is used by, the Aussie lingo that is used quite commonly across the hospitals and general practices, but also the fact that there is this, the systems in place may actually, you may actually find yourself experiencing some communication challenges. This can be both, the written communication skills and also at the same time the verbal communication skills. And I put out a video specifically on how to tackle these communication challenges. And I will put up a link as well so you can see that video, just so you are able to be really equipped in this area of communication that appears to be one of the major challenges faced by IMGs, and we want to see that you start off on a good footing. The second challenge that is faced by IMGs, and I must say I face this challenge as well, is acknowledging your scope of practice. So the scope of practice is essentially what what APRA allows you to do. So remember, as an IMG, you may be coming with a multitude or a very big skill set. Okay, you may have been a surgeon in your country, you may have been a specialist in your country, but it is very important and prudent to know what your scope of practice is as per the regulations set out for you by APRA. So you may notice that some people come in like ICU, like intensivist, and specialists subspecialize in their own countries, but they may pick up and choose to come in initially on limited registration as something as low down there as either an RMO or a registrar. So acknowledging your scope of practice, acknowledging what you can do in the Australian perspective is quite important, because if you end up doing skills that are more than what is expected of an RMO or what's expected as a registrar, you may be doing it in good faith. You may be doing it because you actually have those skills and you're good at doing it. But if something goes wrong, then obviously it will come heavily on you in terms of, your registration. Very important to understand and know what your scope of practice is. In the same breath, it is very important to know the guidelines across your working as a doctor in Australia. For one thing, for things like in my country, you can easily walk to a chemist and get yourself some opioids. In this country, there are regulations on who you can treat as a doctor. Like, I cannot treat my close family members, and I shouldn't be treating my friends as well. So there's no way that I would, prescribe opioids for my friends or my husband or, people that are close to me. So it's very important to know the practice of Australian clinical practice, Australian safe clinical practice, to allow you to practice efficiently. The issue of medical certificates, I get, this asked a lot, can you offer me a MedCert? Can you do that to me? There are specific guidelines as to who you can offer a medical certificate. A medical certificate is not just a piece of paper. It is essentially that you've seen the patient, you've documented that visit in a software, you have come up with a medical certificate based on what the patient presented with, and it is a legal document that you can stand by and say, I offered this medical certificate because this patient was sick like this, and you can go back into your medical records, and if it was ever questioned, you would be able to produce those medical records to say that you saw that person. So it's not as easy as it would have been in another clinical context where you can easily offer this. So knowing what is expected of you as a clinician and sticking by the rules of that, so that you're not in trouble with your registration, you're not in trouble at your workplace, and also you're not in trouble at eventually bridging, your visa if your registration is revoked or you are given some, restrictions on your registration. So it's very, very important to know what your scope of practice is and what, your boundaries of care are in the context of the Australian health system. The third challenge that I have to talk about is the cultural differences and the cultural competency that IMGs experience. So the cultural differences, you quickly learn that being in Australia, acknowledging you may have to undergo what we call a cultural safety course, where you go through things that you're supposed to understand. You maybe have to go through the Aboriginal history, understand where the Aboriginal people have come from, the stresses they have gone through, the challenges that they continue to face, and how they affect their health-seeking behavior. So whereas, another patient coming into you, you can easily just discharge them home and, get them to come back in. In cultural safety awareness and education, you may actually, when you go through the training, you acknowledge the challenges faced, and you offer more particular service to these people, because then at that point in time, you will be more thorough. You will do things that you normally can be done as an outpatient, because you acknowledge the fact that the health-seeking behaviors may be completely different. They may not come back for review and stuff like that. So you want to try and offer the best service. The other thing that I actually noticed when I worked up north is, acknowledging small things, and especially when I also started working in general practice, acknowledging some things like, whereas good communication skill is looking at somebody in the eye and, looking for nonverbal cues and stuff like that, the very, very elderly Aboriginals are not of that. You cannot keep staring at them like, giving them that ongoing eye contact, because obviously culturally you will sort of learn that there's some things that you can do that they will feel more welcome. There's some things that you will do and they will feel not welcome. So it's very important to understand that. The other thing, under the cultural sort of differences that you'll experience, you will notice in emergency department. I worked in emergency department for a long time, and most times than not, as an SMO in ED, you would run emergency room and stuff like that, and you would sort of sometimes be on night shift, just you and other clinical officers, and you would be expected to run the ED. The beauty and the difference in Australia is you will notice that there will always be someone more senior, someone that is also with you on the floor, and to me I feel like that's sort of an advantage. But the challenge would be if you are not used to, understanding that as a resident, you sort of need to pass and run some things by your bosses and say, look, I've seen this patient, blah, 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 blah. I'll be admitting them to the ward, or I'll be sending them home and stuff like that. You may actually get easily in trouble because you are used to working independently, but here you are under your limited registration. You still need to, bounce things off your bosses and bounce things off your registrar and stuff like that. And that can be a bit, confusing for you when you start, because without knowing that you need to do that, and without knowing up to what level can you do that before, sounding like you're too dependent. So it's sort of like a balance that unfortunately you'll just have to learn on the job, what you sort of need to know, how much you can, you can seek for help and stuff like that. It's something that you will obviously have to learn on the job. I'm unable to sort of explain it in detail more than that. The fourth thing, of course, is the difference in the work structure. I've sort of explained that in brief. So the work structure, knowing who is who, knowing your hierarchy, like good clinical practice is, if you have something, you'll bounce it off your registrar. If you registrar, then they will bounce off the consultant and that sort of thing. And being a part of a team, obviously you will not be one that will sort of jump the hierarchy and stuff like that, because obviously that can easily bring conflict in your workplace. So understanding your work structure, understanding who you are to discuss with if you're struggling and stuff like that, who, if things are not going right with your boss, what's the mechanism of trying to sort things out, who's your direct supervisor with APRA, who's the director clinical training, and knowing and acknowledging who you would need to speak to if things were not going right. Very important to know that. And obviously that can come off easily as a challenge when I talk about the next challenge that is faced by IMGs. I actually was going through that survey, and I actually acknowledged that one of the challenges faced by IMGs is actually workplace bullying. And this, of course, took me by surprise a little bit. But when I actually read about what the IMGs were explaining, I actually realized these are things that have happened in the workplaces that I've worked in, that obviously I didn't acknowledge as workplace bullying. But looking back and reading through and going through what actually workplace bullying is, I actually acknowledge the fact there's actually some subtle workplace bullying. And obviously, this can come off in different ways. And one quick example that I come across is people that struggle with, going through their terms, people that struggle because they feel they are not supported as much. And obviously, people that struggle because they feel like there have been opinions made about them. You go to work and you feel like, bosses have already talked about you, regardless of what you're trying to put in place. And people feel that sense of, they were not really accepted. And interestingly, one of the examples that I was seeing there is, some people actually move. And I have had an experience of a friend that I worked with closely, extremely closely. And obviously, she would have meetings with the bosses, and they would say this, and then they told her at some point, we're giving you the last chance to see. And I remember we sat down and we, just listening in to her, and she decided to leave. She decided to leave and go start on a clean plate in a different hospital altogether. And now, when we talk with each other, she's sort of moved. She's finished she got her general registration. She started her BPT training, and she's doing really, really well. So sometimes, what may not appear to you as, bullying may actually be some subtle bullying, and which you shouldn't take it quite lightly. And it's important to acknowledge the issue of feedback. And if you feel you're not getting anywhere with feedback, and by feedback I always say ask for specific examples. Where do you think I did not do right? What do you think I should do better next time? So that you're getting specific examples, because who knows, you could be the problem as well. You may just have a blind spot and not being able to acknowledge the fact that you're not doing really well. And instead of, if you got proper feedback to know where you're doing, what you're doing is not right and stuff like that. And sometimes that opportunity to just, bounce things off each other and sort of say, this is my opinion, I did this because of 1, 2, 3, may actually just realize that it was just a misunderstanding between you and your boss. And sometimes talking it out, getting feedback can actually make you a better doctor. So despite or regardless of what's happening around your work, try as a first point of contact, speak to the person, see where they think you're not doing right, and try together, the two of you, try and put in measures that can try and improve your skills and how you're doing things. And if that doesn't work, then obviously early enough, involve your supervisor and sort of see if you can come up with a program that can help you improve day by day. The other big challenge that I must say, and this is across board, is the cost of exams. The cost of exams for coming to Australia are quite steep. You will notice that AMC1, AMC2, and these exams, some of them like AMC2, the pass rate is quite low, about 30 to 40% pass rate. So obviously can be quite discouraging when you prepare for the exams and then you pay a lot of money up to the tune of 4,000 Australian dollars and you pay for preparation classes. A lot of people do, do a lot of trainings in between. They hire people to train them. And it can easily, the money mounts up every time. You can actually find that you've used up to about 10 grand just to be able to go through 1 or 2 exams. So it's quite costly, can be quite time consuming, time away from your family because you're studying, time away from your family because you may actually have to move and try and do things like WBA program, which is a whole year program, sometimes away from your loved ones, very expensive to the tune of about 13,000 to 15,000 for a year. So it can be quite costly, and you getting into it without knowing this, I feel if you know that the exams are costly, obviously time consuming, you get in with a better headspace to prepare yourself both financially, psychologically, and also emotionally to be able to go through this entire process. And then obviously the last thing that I have noticed the challenges in time management, in efficiency as well. Especially if you work in a place like emergency department where you may not realize that people sometimes are checking on how many patients you see per day. I was listening into a podcast, and this guy is an emergency physician, an ED physician, and I think part of the feedback he was saying is at some point, his boss asked him, why did you see 3 patients in a day? But, and that's why I insist always the importance of feedback. It had been an easy shift. Not many people had come through. Not only was he the one that had seen 3 patients, but also, other people had seen 1 or 2 patients the entire shift. So you cannot see patients who are not there. So I think part of you being able to explain that and talk to the other person and let them know is important. So it's quite important for you to manage your time appropriately. Generally, I would probably say 1 patient per hour. So if you're having a 10-hour shift, aim to see at least, a good number of patients within that time. Obviously, there are chances or times when you will see a difficult patient that you take a long time, because like kids, sometimes you can't rush them along. They have a fracture or they have this, you have to take time to, reassure them, give them pain relief, do a bit more to try and get through a task. And obviously those will be exceptions. But as long as, people eventually know that you are not a slack on the job, that you do the best for your patients, eventually people will understand that you actually are a doctor that care and you're a good team player, and they will provide you more support. So look, there will be challenges that you'll experience like any other job, whether you are in your home country or whether you're in Australia. There will be challenges that will come across when you're starting work. But I think the important thing is to try and position yourself good enough so that, you understand these challenges early, you embrace them, and you don't have the sort of that mentality of like, it's just me. Remember that all of us have had to go through these challenges at some point in one way or another. But look at us now, eventually you'll get your general registration, and eventually you'll probably get into some specialty that you like, and hopefully you'll have a good time working in Australia as a doctor. So I just want to encourage you, whatever it is that you're going through, if you're already here and you're going through a hard time and stuff like that, remember that you are a key, the people that can help you. Remember also to encourage yourself that these are things that a lot of other IMGs have had to go through, and they're still here and they're still successful in their careers. So take it, and one day at a time, things will sort of, the wheel will keep going forward, and hopefully you'll be on the other side. Thank you so much for watching. And if this content is helpful to you, please remember to like, share, and subscribe. That's the only way that YouTube can get us going and can get us to reach more people. Again, thanks for watching.